Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care. For today's video, I wanted to address the frequently asked question, do people die from dementia? So the short answer is yes, they definitely can, but I want to talk about it a bit more. Now, this topic can be triggering for a lot of people, so if death is a sensitive topic for you, this probably won't be your favorite episode, but I will try to keep it short and straight to the point, okay? So there are two things that are going to be important to understand about dementia. So for one, dementia is not a disease in and of itself. It is a syndrome, meaning a collection of symptoms. So there has to be something causing the symptoms of dementia, a condition, a disorder, a disease. So for example, some of the things that can cause the symptoms of dementia are vitamin deficiencies, infections, thyroid issues, tumors in the brain, dehydration, neurofibrillary plaques and tangles, abnormal proteins in the brain like Lewy bodies, as well as alcohol, and the list goes on and on. In fact, there are over 100 different types or causes of dementia, and not all types of dementia are terminal and progressive, okay? So the second thing that is important to understand with dementia is that what is being impacted is the brain. And with true dementia, which we understand as those terminal and progressive forms of dementia, it is going to get worse over time. And this is because essentially what is being triggered by whatever is happening is brain cell death. So to put it quite plainly, the brain is dying. This is why we see the symptoms that we see. This is why we see the changes in behavior and the changes in function, okay? Now, what we must understand is that the brain controls all of our functions. Therefore, as the brain dies, so will our functioning. And unfortunately, that extends to our heart, our lungs, our ability to breathe, swallow, digest, our circulation, our sleep cycles. Literally everything that we have going on is controlled by the brain, okay? So if the person does not die from something else first, like an accident, other comorbidities, or an infection unrelated to dementia, then they will ultimately die from complications related to their dementia if they live until the end stages. At the end stages of dementia, the brain has essentially sustained so much damage that it can no longer communicate with the body and tell it what to do. And there are so many impacts to this, but some of the big ones are the person's ability to move, which puts the person at an increased risk for pressure sores and blood clots, an increased vulnerability to infections, their ability to coordinate swallowing and breathing, and their vital organs will begin to shut down. So yes, people do die from dementia, not from the symptoms like cognitive symptoms, but from all the damage that's being done to the brain, resulting in both indirect and direct complications, okay? So what I'm going to do is link in the Eye in the Sky a podcast episode that we did on how dementia kills. If you're interested in learning more about this topic, I definitely recommend that you check out that podcast episode. If you have any questions at all, please feel free to leave me a comment. And until next time, bye guys.